Sweet. My name is student Dr. Evan Heidenreich, and this afternoon I have the opportunity to talk to you about our virtual reality and haptic simulation training in the predoctoral dental program. And so huge thank you to Dr. Gordon, student Dr. Aaron David, and Angel Co for helping out on this project. So to start it off, dentistry is a very tactile profession where lots of technical skills are required, and they need to be mastered before we get into the clinic because dentistry is the type of thing where we're working in millimeters, half a millimeter. So we need to be very precise with our hands. And so in order to train that, our typical training includes using typodonts, plastic models, and natural samples. However, a lot of times those are limited by the material costs, the realism, and then the patient safety risk factors. And so in the recent years, virtual reality and haptic simulators have emerged as a very effective tool in order for us to improve our students' skill development, knowledge retention, and confidence. And so here at KCU, we're trying to work on working with the VR simulators in tandem with what we're doing with our traditional training types. And so VR and haptic simulation offer a very immersive learning experience that is realistic and provides a very repeatable experience that students can just practice over and over again. So why VR in dental education? So we believe that this builds our students' skill development and confidence. You have numerous types of procedures across dentistry, and all of those can be incorporated into a single system with this VR simulator, and it provides a very consistent training experience that every student gets to experience. It allows you to have unlimited practice attempts, which reduces the amount of costly resources, because a tube of VPS impression material costs $70. So if we can reduce the amount of times that students have to go through tubes like that, the better it is. These simulators also have haptic feedback, which gives you different feels for the types of tissues that are in the mouth and oral cavity. So you'll feel different things with the different types of instruments you have, and then that's also up against the soft and hard tissue in the mouth. Another great thing is that they provide immediate feedback that the students can see, and it helps with the retention of psychomotor skills. And one of the things that we're currently working on is importing patient scans, and we can actually practice on our live patients before we go in and do the procedure, so that way our students feel way more confident going into those procedures. So our purpose for this project was to assess the effectiveness of VR simulators in enhancing the dental students' technical proficiency, confidence, and procedure knowledge retention, and then to also gather qualitative feedback from the dental students regarding their experiences and perceived advantages of the VR simulators in their preclinical education. And so we ended up hypothesizing that there's going to be significant improvement in the students' performance and confidence in their preclinical skills using the VR simulators. So we're going to start with prospective observational studies of the D1 and D2 year students. Approximately 160 students will they'll be a part of this project. And so we're going to look at their skills on manual dexterity, operative dentistry, local anesthetic injections, and then periodontal probing. And then for each of these types of things, we're going to set a faculty gold standard so that we can compare the students to someone who is actually clinically trained and proficient at what they do. So this is the workflow that we started with for our training. We had the faculty start by receiving standardized continuing education on the VR simulators, and from there we selected our gold standards from the faculty who would work to compare against the students. We then trained our students specifically for the data that I'm going to be talking about today for a local anesthetic. That's what my class, the D2s, just went through. And so we got training in class, and then we got 30 minutes to experiment on the actual VR simulators to learn how to actually give injections. And then we took the first 3 attempts from each student and compared them to the gold standard. So these were the results from our actual injections. So if you're a numbers person, we got numbers on the left, graphs on the right. So our gold standard was about 6.9 millimeters away, and so that's what we would want to clinically hit when we actually put the needle into the mouth. And so as you see, the first attempt to the third attempt, our numbers got much closer, so our accuracy was improving with our students. And then we also have our standard error of mean, and so with those standard error of means getting tighter, we saw that the precision of the students was also increasing, so that was outstanding data overall for both the inferior alveolar nerve injection and the lingual nerve injection. And then at the same time, it also measures the amount of volume dispensed into the patient. And so we saw across the board that generally the students were very good, accurate, and precise at injecting the correct amount of volume that they were supposed to be injecting. We then monitored the student feedback success. So after our session on the VR simulators, we got together with the students and we asked them quite a few questions. We rated them on a Likert scale. And then we're also going to be doing questions after they go through their clinical training. We're doing peer-to-peer injections, and so that's actively ongoing. We're on week 3 of 4 for that, so we'll be getting that data in soon. So overall, these were 4 of the numerous questions that we had asked for our students, and just outstanding feedback overall in how we perceive these VR simulators and how effective they are going to be in a clinical setting and how they're improving the student confidence. So overall, we saw a significant improvement from the first to the third attempts, where we saw increased accuracy and precision. The response rates showed very positive feedback for the use of these VR simulators, and a lot of them have increased confidence going into their peer-to-peer injections. A couple of our limitations included the restricted number of simulators. We only have 4 for 80 students, so there's a limited amount of time they can be on there. This is short-term looking training outcomes, and we're not really looking at the long-term effectiveness, which is something that we'd like to get into. The VR doesn't fully replicate all aspects of the patient, and then there's also self-reported feedback with the questions we gave, so there may be a little bit of bias there. So in the future, we're looking at the data after the peer-to-peer injections. We're also going to be starting the D1s this year, early on with it, with manual dexterity, to see if that has any difference between the D2s and the D1s and their test scores. We're also working with a couple faculty members to create custom standard teeth that we're using for the ADEX, so we can actually train students for our board exams. And then we also have periodontal custom probing depths that we're going to be looking at for our perio course. Huge thank you to the Provost Office, the KCU IRB, the HRSA grant, Dr. Weinstein, the SimDicare team, and Dr. Vincel, who was our gold standard for the local anesthetic. Here's our references. Are there any questions?
I was curious, I mean, my challenge always with VR is the haptics. There's no feel, and I was curious how that actually worked here.
So for our haptic simulators, our SimDicare team was actually able to program in a feeling. So whenever, say for example, for local anesthetic injections, it feels like you're just free floating. And then when you get to the soft tissue and you press, the handpiece will actually give a backwards press feedback. So you actually feel like you're going into a soft tissue. And then when you go all the way in for the inferior alveolar nerve block, you're supposed to touch bone. And so when you reach bone, it's a hard stop that immediately doesn't let you go any further. Yes.
That's a wonderful question, and thank you, Evan. You did a lovely job. And but I would welcome everyone here to come see our virtual reality simulators. These simulators, the density of enamel, hardest tissue in the body, 70% mineralized tissue, is hard. When you go when you're drilling enamel, you fall into dentin. Dentin is soft tissue. It's 50% mineralized, about the same density as bone. And then when you go through the dentin and into the pulp of the tooth, that's all soft tissue. You feel the drop. It's really remarkable. Dentistry is incredibly tactile, and they have reproduced the tactile sensations. So if anybody wants, you're welcome to come try it. We'd be happy to put anybody on it. Just to give you a sense. And if the medical students want to learn how to do local anesthesia, we can teach them how to do that too. So nicely done, Evan.
And
thank
to
you.
add on to that as well, the teeth that we currently train on in our Charlie heads, they're plastic teeth. So when you take a Burdua at 200,000 RPM, it just goes right through those plastic teeth. But on the simulator, because it has that actual feel, you get a little bit of that clinical feeling where you're actually going into a really hard substance, and you get the feeling of, oh, I have to press this amount of pressure in order to actually go through the tooth.
Is there any gate? Oh, great. Actually, a fun question. Is there any gamification in any of this haptic technology? Like we can do some things and scores and things of it? And so my question is, do the students enjoy doing this, or do they
Yes.
see it as a task that I have to get through?
The students have been begging to use the VR simulators, and so they were absolutely ecstatic about us being able to use them for the inferior alveolar block. And then when we had Dr. Weinstein out here doing continuing education, she was talking about like a national competition using these VR simulators where we could actually compare scores across the entire nation.
I love it.
The students want to use it more. They want to know why it's not integrated in the curriculum. That's one reason why getting the data is important.